Hello and welcome to Chloe Man Stupid episode 2, folks. We made it to episode 2. For this one, I had a chat over Skype with Scott Ross. Scott is a licensed psychotherapist based in the Seattle area. The reason I wanted to sit down with him was because he's part of this new wave of psychotherapy, which is growing stronger and gaining popularity, namely drug-assisted psychotherapy, which I'm sure will be the first time for many to hear about this. And you might feel some stigma and taboo around this topic. And that's exactly why I want to talk about it, to raise the conversation or raise awareness, because it has so much incredible potential when taken in the right constructive environments. Scott is licensed to give ketamine-assisted psychotherapy. We talked about the current state of drug-assisted psychotherapy, where it's heading to in the future, and we also got talking about psychedelics too. So I hope you enjoy the first episode exploring these topics. I know I'll be doing many more of these in the future. So if you're interested, hang around, stay tuned. And if you want to help out this little podcast of mine, a rating and a review on whatever platform you're listening to this really helps me tremendously. With that being said, I hope you thoroughly enjoy this second episode that I sat down with Scott Ross, Ketamine-Assisted Psychotherapy. Let's get it. Big kisses. Mwah. Now the audio should be recording too. Great, cool. Scott, thank you so much for coming on. I can't thank you enough to agree that you lend me some of your time and have this chat, man.
Mm-hmm.
I'm really excited for this episode because it's I'm willing to I'm wanting to explore the new wave of psychotherapy that's kind of happening, and I think this is a great first episode. You being part of this being part of like the vanguard of this new wave of psychotherapy that's happening. So would you mind sharing how you got into this field and how your journey has looked up until now?
Yeah. So yeah, I'll start off kind of how I got into the field of psychology in general. In high school, I kind of had a little bit of interest in it and ended up picking up Sigmund Freud's interpretation of dreams, and then also a book that was on kind of the case studies of like extreme psychotic states, drug-induced states, and just got really fascinated kind of in the exploring these kind of deeper aspects of the human mind and consciousness. So I mean, at that time, I started interpreting my own dreams and kind of just exploring like where that could go. So yeah, kind of went through the whole school process with undergraduate and graduate school, and yeah, continued to have a lot of interest in I guess I'd say the more kind of phenomenological approach. So figures like Carl Jung were really prominent for me, in kind of the sense that we don't just have to look at things objectively, kind of as an external approach, which a lot of the like cognitive behavioral type approaches tend to go that way. But instead, that by kind of turning inward, both with ourselves and in actual psychotherapy, that we can gain an insight to kind of a different layer to the human conscious and kind of live from that place. So, you know, as you might be able to guess, that's not a long shot off from psychedelics and what you kind of get from it. So in my studies, which I think, let me check. I think I'll get in that a little later. But yeah, I encountered some of the research going on by like MAPS with Rick Doblin, particularly with MDMA psychotherapy. And that just kind of launched me into really starting to study this stuff.
Oh, that's so interesting. Because I recently picked up a book that MAPS published, and it's they published it alongside with Stanislav Grof. It's called Way of the Psychonaut. It's a 2-part encyclopedia, and I mean, it's been a while since I've been so intrigued and interested and just sucked in by a book like that. And it also explores how you can use these substances and also breath work to help people going through tough times. And it's so mind blowing that the old way of looking at psychology is kind of being turned upside down with the use of these substances that have been illegal for I think like 50 years. I'm not really quite sure about the time. Yeah. So what research is like currently happening now that you are most excited about? Are you aware of new studies that MAPS are doing?
Yeah, MAPS is right now in with their MDMA, which their primary area they're researching that for is for post-traumatic stress.
Mm-hmm.
So they've done a lot of work with like veterans, victims of sexual trauma, and that's part of their approach, which I love. They're going after these groups that traditional therapies and medications don't really touch, right? And so the results, the outcomes for these groups are awful. You have extremely high suicide rates. These are people that are severely debilitated in their life. And in the case of veterans, people who have really put their life on the line for others. So they've been utilizing it for those groups, and now they're just moving on to what they call phase 3 trials. And that's the last step. It's the more wide scale studies. And if that goes similar to phase 1 and phase 2, then we're looking at probably, my guess would be about 2 to 3 years before MDMA could be fully approved for therapy. There's some question marks there, but they're right now MAPS is in the process of getting it approved for expanded access, which would mean they could actually use it to treat people outside of trials. So those with PTSD would be able to go to certain clinics and actually get treatment. So that's super exciting. Another thing that's really exciting me is at Johns Hopkins. They just opened, I think it's like the largest psychedelic research center in the world. And Roland Griffiths is the one heading that up. And it's the cool thing about this like new wave of psychedelic research is the people that are heading it up, their records are impeccable. He had a long history of doing drug research, and was one of the most well-regarded in his field before ever stepping into the psychedelic field. So he's not seen as this kind of fringe guy. He's got the credentials. But part of what they've been doing there is they've been exploring not just for treating the unwell, but psychedelics to potentially enhance those that are doing fine in life, but maybe could do better than that. It's this kind of this would be the more like humanistic psychology area, which doesn't look just in terms of treating pathology or illness, but looks at actually this idea of like self-actualizing. So they're doing a study right now. I think they're almost done with it on. They've taken different seminarians and clergymen. So I mean, I think they've got various like branches of Christian clergy, other faiths like Hinduism and Buddhism, and so they're seeing if it enhances their spiritual practices, and then also if that has benefit to kind of what they can bring back to their different spiritual communities, and enhance what they offer there.
Wow, I've never heard of psychedelics being administered to I mean, how people who are have been doing meditation and those mindfulness practices. But that sounds really really interesting. Also, that I feel like if it gets approved in the USA to use MDMA and ketamine, these psychotherapy environments, then it's just a matter of a few years before most of the world would just follow. And I think that acceleration will be really tangible once that it gets legalized in the US.
Yeah, and it's kind of, I think you're onto something there. Like, I think it's going to be kind of a reverse of what we saw back in the early 70s with the Nixon administration turning all these into Schedule I substances. They were very coercive with other countries in pushing them to do the same. So there was a lot of pressure for this to become kind of a global war on drugs. So yeah, with kind of the country that's driven that for what now, about 4 decades. If we're seeing some changes there, then yeah, I think you are going to see that around the world, which we already are to an extent. Israel's doing some different studies. I think MAPS is collaborating with. They're doing this in Canada. Yeah, it's spreading for sure.
What's Israel doing right now? Because I know that in Portugal, I don't think they've legalized everything, but I do think they've decriminalized everything, even the harshest ones like heroin and opium, and you now see a decrease in the black market. You see decrease in addiction rates. You see decrease in deaths due to overdoses, and it's because they get facilitated with these facilities where they get offered clean needles. They get offered help with I mean, if they want to talk to people, because these people are very often just I don't know if ostracized is the right word, but kind of pushed away by people, and they have a safe environment to handle their addiction, basically, where it's more seen as an illness and not like a crime that you have this personal struggle going on. But could you explain what's happening in Israel?
Yeah, to my knowledge, Israel's kind of like an extension site to some of this MDMA research. So they're doing, I think both Israel and Canada have at least one. I think there's multiple sites where they're also doing these phase 3 trials. So that's kind of what MAPS has done, is they've looked to some other countries to branch out and collaborate with.
Yeah, there's
their system.
I'm a big fan of Tim Ferriss and his podcast, and he recently, a few months ago, I haven't seen the documentary, but he strongly recommended watching a documentary where you see these war veterans in Israel going through MDMA therapy, and I mean they step in the room, torn from these war activities, and they step out of the room just completely transformed. And I mean, it's hard work, right? They cry, they completely break down, but then afterwards they say, man, this was like 15 years of therapy in one evening. And I mean, they kind of immediately take the stance of this has to be legal, because this can just benefit so many people.
Yeah, I mean, in a big part of that with war veterans is like they're trained to kill, right? And so to be good at their job, they need to be able to take lives, at a second's notice. And while we can understand that, that's kind of the conditions of where things are at right now, how do you integrate someone like that back into society, right? How do you have them do a 9-to-5 kind of job, or raise children and, attend family events?
Hello? Hello? What's going on? What's going on?
To actually feel compassion towards it and see it as a acceptable part of who we are.
Oh, I'm really sorry, Scott. You fell away for about a minute. I'm really sorry.
Okay. Yeah, the video feed went out there for a sec.
Sorry, would you, I'm not sure if I think it stayed recording, but would you mind repeating what you just said?
Yeah, so a big thing with what you're bringing up with veterans with the MDMA sessions is with being trained to kill people. When they come back into society, they have this expertise in something that outside of war is not acceptable. And so the idea of integrating someone like that back into society, um, we can't have a model where we integrate them by just saying kind of let that part of you not exist anymore. Um, that that self that knows how to execute what they need to at war has to be honored, has to be cared for. Um, and so in these MDMA sessions, it really opens that up. This idea of self-compassion, where even the kind of darker or difficult to accept parts of ourselves, we can gain this sort of broader, wiser perspective, um, from which we can integrate even those parts and love and accept them.
Is there a big difference between like the whole process of and session of MDMA assisted therapy and ketamine assisted therapy?
Yeah, there's definitely a lot of overlap. But MDMA sessions are generally going to be spread out longer. Can't remember off the top of my head. I think it's at least a month between sessions where they're actually taking MDMA. And a lot of that is how the drug actually works. There's problems with increasing frequency beyond that. With ketamine, you can do pretty frequent. Oh, there we go.
Yeah.
Ketamine you can use a lot more frequently. You can even do weekly sessions.
Wow.
Weekly session. We can even incorporate doing lozenges for at-home sessions, which I'll get into that more later. But I guess when you're looking at a comparison, MDMA, like a common term used for it, is an empathogen. So pretty much that it opens our empathy, which therapeutically is really helpful. So with ketamine, when you do lower dosages of it, so like we would use 4 lozenges, or there's some practitioners that will do injections, but at very low dosages. It does a similar thing where you feel more connected to yourself and to others, and are able to access sort of the compassionate, loving centers of the brain rather than more of the fear and anxiety centers, which those pathways are, you could say, mutually exclusive. When someone's more operating from a fear place, it's really difficult to access compassion. So this is what you run into a lot in traditional therapy, and I have myself clients dealing with more severe PTSD. It often takes years to build the level of trust to where they can really get into stuff at the level they need to. And that's because whenever you start getting into kind of their trauma narrative, you're getting into it with the emotions of fear and in that kind of hyper aroused state. And to build a level of trust for them to do that and actually get through it, is typically, from what I've seen, can be in the range of like 2 to 3 years of weekly therapy. With ketamine, with MDMA, you're looking more at like a handful of sessions. It's important to build that initial trust, but once they kind of get an idea, yeah, this is someone who has my best interests, they're pretty tuned into where I'm at, then you can move into administering the medicine, and you go right into these more kind of empathy centers. So with ketamine at lower dosages, it can be used pretty similarly to MDMA.
Oh, and how does like a traditional normal ketamine session flow? So you have a few initial sessions so that you get to know the patient, and then like how would it normally play out?
Yeah, so typically I do an initial therapy session where I'd be assessing and diagnosing, getting a good sense for where the person's at, what they're hoping to get out of it, and things like their history. So looking for things like trauma, abuse, but also then looking for things like spiritual practices, different relationships where people who they feel comfortable talking about those kind of things too. So getting all that information, and then from there shifting to kind of giving them an overview of like what to expect, and then some different models, some sort of frameworks for unpacking their experiences, so that they're when you can bring back the experience and have some frameworks to sort of analyze it from, you can get a lot more benefit. So that's the initial session, and from there, then we move on to doing a ketamine lozenge session. So lozenges are ideal for lower doses. So what we're doing typically is giving them, we do them in 100 milligram doses. So they do an initial medical intake with a doctor, just kind of checking over, make sure there's no serious thing that's going to hold them back from it. Which ketamine is super safe too. They use it in pediatric surgeries, and I mean there's not many things that get in the way of people using it. But anyway, then we set up the initial session. So I create a lot of playlists for it, using world music, ambient music. I'll use different electronic stuff. So the idea behind that is really kind of keeping the flow to, I'd say like two key things are the flow and the space, right? So when you listen to music, if you kind of keep that in mind, right? Like, how does this open up space, and what kind of space does it open? And then how does this move me along? So when I'm designing a playlist, I'm not wanting it to say drive them at a fast pace the whole time. I want some time where it feels spacious, where they can kind of explore, but I also am incorporating sometimes a little faster paced stuff, so they don't get stuck. In music in that way is very helpful for using it therapeutically. And Stan Groff has written a lot on that too. So that's kind of one piece is having a playlist set up for them. And then typically I read an invocation. So it could be a poem. It could be something that would feel a little more like a guided meditation, like getting them in touch with their breath and their body. But that's sort of setting the tone and mood of the trip. So as I'm doing that, they're lying down on either a couch or a bed, and we have blackout eye shades. And then I offer them the lozenges. So they start with one, they take that, you swish it around your mouth for about 10 minutes. By that time, you're starting to feel the effects of it. And one of the cool things with ketamine, compared to something, say, like psilocybin, um, is it's got the sort of anesthetic qualities to it, which physically are very relaxing, and mentally are also very. It often puts people in this sort of at ease state. Um, so by 10 minutes, most people are starting to feel that. Um, and then after that, I wait a little bit and then check in. Are you feeling good where you're at? Do you want to go further? Um, and generally, if what I encourage them is, if there's part of you feeling like you want to go further, like, jump right in. You might as well. You already paid for it. Like, let's get the full impact. Um, so then I offer 1 to 2 more of them. If someone wasn't feeling much at all, I'd probably go 2 usually. Uh, so same process there, hold it in 10 minutes, switch it around. By that point, they're getting pretty deep into it. It's uh, so in kind of the psychedelic therapy, there's 2 different categories to think of. One is psychedelic therapy, which would be like mind manifesting, right? That's the kind of like traditional trip. And then there's psycholytic. Psycholytic is mind loosening or ego loosening. So on lozenges, we're generally going more for like a psycholytic state. Uh, so when someone gets in that, they feel very at ease. They feel very disinhibited, more connected with their emotions. So often there's a good stretch of the trip where they will be, they'll just be sharing like all these insights that are coming up. They just freely flow. And so during that, I'm writing down a lot of what they're saying, often just giving a little bit of feedback. But when people are in that state, they do a lot of the work. It's not like I'm sort of a guide in the sense that like I'm running things. I'm more kind of keeping the space for them and keeping them moving if maybe they're getting a little disoriented or need just some direction. So that's the first session. When they come back down from it, which is typically within an hour, someone's dropping down to kind of an in-between state between normal consciousness and like the full-blown ketamine state. So at that point, we're kind of starting to like, what are the insights you've got? Let's start putting this together. And then about after that, so around like the 2-hour mark usually, is where someone feels like they could move around. This sort of, because you get dizzy with it, sometimes nauseous, but often like you can get kind of swirly vision and light sensitivity. So by the 2-hour mark, that's usually wearing off for people. So then we move to a setting where they're able to sit up more. We offer some food for them to kind of recharge. And that starts to feel a little more like a typical therapy session where we're exploring the insights they've got. We're looking at ways they can integrate it, how this has shifted their understanding of their life. And so one of the things that's also doing that first session is that's giving us a good sense of their sensitivity to ketamine. So based on that, and based also on their just individual needs, like what they're looking for, we might prescribe them ketamine to take at home. And so they would pretty much do what we did in that session at home. And we do a quick check-in like over phone before and after their at-home sessions, to see how it's going. And then we'll often have like weekly therapy sessions where we continue to integrate it. And then from there, we do at least an additional 2 sessions. That's kind of like the minimum standard we encourage is 3 sessions. So the next 2 are both going to be intramuscular injection sessions. And that's kind of like like that's the payoff. That's kind of the gold mine of the ketamine experience. And from what I can tell, a lot of like recreational use, people aren't hitting that level. You got your kind of psychonauts that go there, but I think a lot of people start hitting that space, and you can't hold together your thoughts anymore. Your sense of reality starts to go. And so for a lot of people, I think they start to look at that as they're kind of topping out on what the drug has to offer. Um, but therapeutically, to me, I'm like, that's the gold. Like that's what you want to step into.
And that's what's called the K-hole, right?
The K-hole, yeah.
Okay.
K-hole, like a term we'll use for it, therapeutically is ego dissolution.
Okay.
And so the reason why you can get there a lot better with the injection is that you're getting so much more, such a higher percentage. It's right around 100% of the ketamine going straight in. Whereas with lozenges, you're getting, I think, like more in the range of like 30% or somewhere around there. So when you do the injection, the same thing, I get the playlist going and everything. I usually have a more condensed version that's a little more, the music kind of guides it a little more. But our doctor gives them the injection, and within about 2 minutes, they're gone. And usually people at minimum are gone for about 30 minutes, but up to about an hour and 10 minutes. And so from my perspective, they look like they're, sometimes look like they're sleeping. Just to start having these really deep, like full, kind of stomach breathing, right? Where you see the stomach really rise and fall. And then occasionally they will have more physical responses. So sometimes people will have these sort of movements they'll do. They might, with their arms, kind of put them up in the air and be doing these. It looks almost like some like dance movements they've planned out. And so you can see things like that. Sometimes people will have other kind of physical things they're working through. But yeah, a lot of it, they're off in some space, which I can go into that a little bit. Might be interesting. So part of my training in this, the place I got trained, I got to take both a lozenge and have an injection session. Which is great, because having firsthand experience of these states, to me, is essential.
Yeah, agree.
So with the injection session, my own experience was like, I started to feel the substance come on. By the time they did 2 small injections, like one on each arm. So he did the one on the first arm, and I'm already feeling it coming on before he's injected the second. And at first I feel this kind of rush of anxiety, like, oh, where's this going? And then kind of right along with it, it was like, well, you've already got it in you. Like, you're going for a trip, whether you like it or not. And that was very peaceful. But my sense of self almost immediately started to come apart. To me, it felt like these sort of like planes of consciousness, or these kind of walls of self that started to separate out. Never experienced anything like this. And then it just started to go. Like, I was like falling down tunnels. It had all this kind of synthetic like stuff going on, and the music like kicks in. Like, with myself, I was like, they've been holding out. Like, this music that, the other stuff they're playing, which I'd experienced in normal consciousness, compared to what this was, night and day. And I get that almost every time with clients too, where they're like, that music's freaking awesome. But it does just that, right? It kind of opens these spaces for you, and it keeps your flow going. But yeah, so you then go through the K-hole, or these tunnels, which it varies in what the significance is for people. It can feel like they're going through some sort of birth rebirth process. It can be this sort of like life review, where these tunnely things, some people describe it as like frames, like, if you on a computer, you have kind of the windows, right? So if the computer like starts to freeze, you get where there's like a bunch of little frames. It has that kind of effect sometimes too. But each one of those will kind of take on like this, where you're kind of having an overview of your own life. Some people kind of, it could be like the history of humanity. But it's accessing all these kind of layers of consciousness that we just don't have many other ways into. And the other thing with that, and if we're looking at, well, what is kind of going through all these tunnels and all this like bizarre experience, what does that have to do with like therapy and healing, right? Well, what I see is that you can look at most people's like what we would classify as like mental health issues, right? You could look at it as a sort of way of armoring or protecting, right? So someone who's dealing with anxiety, right? They often will, one of the symptoms is muscle tension. And so you see that if someone literally kind of like winds themselves up or tenses themselves. And then when we start exploring their thoughts, right? Like they're focused so much on like fears and like, what if this happens? What if this happens, right? And then when we look at more like depressed states, it's almost like the body and the mind have gone into hibernation, right? Which is another form of like trying to survive difficult circumstances. In both those cases, like that's not a thriving organism, right? That's a pretty, unless the conditions require that, that's a maladaptive way of like living. So what I see is when people go into the K-hole, it's like you're lifted from that pattern, right? And so like I can see the person's body relax and their mental state completely shifts. And so when they come back in, it's kind of like, oh, that's what's going on. That's what I've been missing. Like, this feels great. Like people will be laughing, sometimes, they might, oh shit, like that's it. And it's not, they don't even have to put it into words really. There's just something that like at a core level is like, okay, now I get it. Yeah.
That sounds fucking awesome, man. That people can just have such a transformative experience. Where, because like it's kind of developing and still not quite legal, but we're getting there. Where did you get your training, and how does someone get trained in facilitating like ketamine or MDMA assisted psychotherapy?
Yeah, so I got trained at it's called the Ketamine Training Center, and it's ran by Julaine Andrews and Phil Wolfson. So their primary locations in California, outside San Francisco, but they partner with several other clinics around the U.S. That will host the trainings. So yeah, they do a 4-day training, and their approach is really focused on using it. Using it for psychedelic therapy, which this is a big split in the when you look at ketamine-assisted therapy. You have sort of the psychedelic model and the medicalized model. So the psychedelic model, you're using higher dosages, and you're intentionally inducing the psychedelic state, whether it's what I was talking about with like the psycholytic, where you're getting this deep kind of reflective state, or the more like K-hole experience. The medicalized model, they're kind of doing everything they can to minimize that. So they look at it as like an unwanted side effect. So typically, like the IV clinics, you go in, you get hooked up to an IV, and they give you like a low dose drip for about 40 minutes, and you do that, however many times till you're feeling better. But you don't really experience a lot internally outside of maybe being in this kind of relaxed state. So yeah, right now, to my knowledge, like the ketamine training center is really the only ones that are offering the psychedelic model. And this is the same people who have published the ketamine papers. Phil Wolfson was like the main editor of that. And that goes through like a lot of the research, but it has like a focus on more like psychedelic use of it. And that was actually, I think it was published by MAPS. So that would be one route to go specifically for ketamine. For something like MDMA, MAPS just this year has started offering trainings for that. And the third option would be there's a California Institute of Integral Studies, and they have a master's and a PhD program that both I'd say it's like transpersonally oriented, and definitely incorporates a lot of like psychedelic therapy. And they've also, I think they've had it for about 3 or 4 years now. They have a psychedelic therapy certification program. So if someone already has a master's or a PhD and they want to get that certification, I think it's like an 8-month program, and they go over a lot of the basics so that by the time you're done, you'd have the skills needed to practice when this stuff comes out.
That sounds really interesting because the transpersonal psychology field, I mean, the way of the psychonaut, that encyclopedia that Stan Grof wrote, was my very first book that I ever touched on psychiatry, and I feel I couldn't have picked a better one.
Yeah, it's a good place to start.
And it's a bit of a pity that I'm not too old. I'm 22 now, but it's a bit of a pity that I haven't discovered that earlier, because studying that field really, really would, sound so interesting, and it's so new as well. And it's very exciting to see where that field is going, and how, I hope it's gonna expand very quickly and gonna catch popularity as well.
Yeah.
I had a question, and I'm not really sure if you're allowed to answer this, but if so, then because of patient confidentiality. But if you maybe know another story of like a very remarkable recovery that someone had that was really struggling, and then did MDMA or did ketamine-assisted therapy, and just was able to transform radically.
Yeah. Let me think here a sec. I'm trying to think without going too much into confidential stuff. One example that I've seen is a client who was dealing with treatment-resistant depression. So for years had been on various antidepressant medications, had sought out therapy, and really just couldn't get out of that depressed state. So this client, one injection session, like, he came out and it was clear. He was beaming and just kind of on top of the world. And to me, so we've had multiple sessions now, and it's been similar, where it's like, I think there's certain people that have this pretty pronounced depression, and I've experienced this with clients that I haven't that I've seen in therapy but not done like ketamine therapy with, where they might not even be the best candidates for like, hey, come in each week and let's talk about what's going on in your life, right? And that's going to kind of help over time. Like that's a certain type of depressed person that is going to benefit from talk therapy in that way. But I've encountered numerous clients who that doesn't seem to be how they operate. Um, in what my hunch had been, and this client really has kind of confirmed that, is that certain people, what they really need is access to that different state. And when they get access to what it feels like to be happy, to feel joy, to have fun, to laugh, um, that's what they need. They just get a taste of it. And now it's like, all right, now go like live from this place. Have that be your reality. And so then when we do sessions, it's a lot less of like, okay, let's go into all this like trauma or this stuff in your life, but more like, all right, like how's it going living from that place? Oh, you're starting to sink back into it. Let's give you another session, kind of get you that access and keep practicing. And in that way, it becomes sort of a form of meditation, right? It's like meditation with these catalysts to access what you're aiming for.
What's really cool about this way of treatment is that it's not dependent upon, I mean, yeah, of course, it's good that people get followed up and that they maybe in the beginning I didn't know that you could go once every week with ketamine, but the essential part is to not see the patient back again, right? That they can that they're completely healed and that they got out of this rut and that they don't need to buy medication all the time and they kind of get sent off on their way. What I'm really curious about is how the psychotherapy community, I think you can call it, is reacting to this new wave of psychotherapy, and is there still as much taboo surrounding the use of drugs in psychotherapy, which is, I mean, it's kind of unrightfully so, but I mean, it's been illegal for 4 or 5 decades, so it's kind of understandable. So how does the community look to this new wave?
Yeah, it's opening up a lot, is what I find. I'm especially the last couple years, I'm finding a lot more curiosity. If I bring it up or it comes up in conversation, I'm getting a lot more of like, oh, like tell me about that, or oh, I have a client that would really benefit from that. And there's multiple factors. I think some of it's that like this research is getting pretty far along. So you're seeing more stuff in major publications coming out. Also things like Michael Pollan's book, How to Change Your Mind. That's been huge. I probably at least like half the clients I've worked with, whether it's for ketamine therapy or psychedelic integration work, like they come across that book and it's like, okay, like, yeah, he's on to something here. And one of the things I love with Pollan's book is that he comes at it initially more as an outsider that's actually trying to just see what this is all about. And one of the things with psychedelics is it's kind of like once you've drank the Kool-Aid, like it's hard not to get like super excited about it. And I don't think that's a bad thing. I mean, you see that in almost anything that's kind of a value, that once you experience it, you're like, people get that with skydiving and all sorts of stuff. But to those that haven't been exposed to that world, having someone that doesn't come from that perspective is very beneficial, and kind of normalizing it as like, this is a legitimate area of study and it has a lot of potential that we can't ignore.
Yep. I haven't picked up the book, but I have listened to it because I'm a big fan of the audiobooks, and I think I'm like halfway through, but I should definitely pick it back up again. Do you have any other book recommendations?
Oh, probably a lot. I mean, the Way of the Psychonaut by Groff. I haven't had a chance to get that yet. It's on top of my list to get, but Groff is, for those more interested in like the therapeutic use, um, Groff is as good as you get. One of my favorites by him is LSD psychotherapy, and that goes over. I think he had close to 3,000 sessions, LSD sessions with clients. And then what you mentioned earlier, him and his wife Christina Groff developed holotropic breath work, which is pretty much this form of a specific type of breathing that induces an altered state that at least has some similarity to some of these psychedelics. But yeah, that book is a great one to look into. Let me think here. The more philosophical end of it, and this was kind of my initiation into psychedelics, was Aldous Huxley. So the Doors of Perception. Yeah. Nice. And then he has the sequel, which is Heaven and Hell, which you can usually find those in a single book. But it's a great kind of opening into how to think about it. Yeah, let's see here. Ketamine papers are a good one if for specifically looking into the research on ketamine. Let's see here. Another author that's kind of related interest is Ken Wilber. He's a pretty prominent transpersonal, he's a psychologist, philosopher. But he offers a lot of useful like frameworks and structures for understanding any of these kind of experiences and how we can operate in them and how to relate to them. Yeah, let me think here. Oh, another great author to me, this is like fun reading. Don Lattin. So he's written several books. He's kind of he gives a lot more of kind of the cultural and historical aspects of it. But he has like one book that he wrote I really liked was Distilled Spirits, which it gets into what's it thing? Aldous Huxley, and Bill Wilson, who was a founder of AA. And the third, I'm drawing a blank on his first name. Last name's Hurd. He was friends with Huxley. But it takes these three people, and it kind of goes through their life, and it brings in also how psychedelics had informed that. In the case of Bill Wilson, which I don't know how much you're familiar with, like the AA movement, but the fundamental basis of AA and these 12-step programs, which are like a huge part of the addiction treatment world, is having this kind of spiritual awakening. And based on that awakening, that you give some kind of acknowledgement to a higher power to the best of you that you understand it. So this was like the basis of AA, but what it turns out is that Bill Wilson, for his own treatment that led to developing this model, he went to a clinic where they administered belladonna, and belladonna is a deliriant. It's not a good choice compared to the other psychedelics, but it's a kind of thing that, like, you hear like the witch's brews and that kind of stuff. Like this would have been a substance that would have been used in that. But it puts you in this kind of delirious state in which you often can have visions and spiritual experiences. So that was the basis of it for him. And then years later, he was introduced to LSD, and he took this to the AA communities, and we're like, we need to incorporate this into alcohol treatment. And they all thought he was crazy, because they're like, why would you use a drug to help people, get better from a drug? Really simplistic understanding of addiction or drugs. But anyway, so this book gets into his story. Huxley, who really was like, you look at his influence on the Beatles and on, you know, bands like The Doors and really the whole psychedelic 60s movement. And he was kind of one of the prominent philosophers and thinkers behind it. So yeah, Latin has that's one book. He has several others that similarly get into a lot of the cultural aspects of psychedelics.
Sorry, you mentioned holotropic breathwork. Do you have any personal experience with that?
I don't personally. We have some practitioners in the area. I'll probably do it at some point, but just haven't gotten around. Around the time I was looking into it, I had some opportunities to try some psychedelics, so I went that route.
It's a pretty nice segue to actually, what was your first psychedelic experience like? Was that like the big eye-opening one, or how? I mean, because like you said, once you've tried it one time, I mean, not like it's addiction, not like it's addicting, but you kind of, you know, because it's against the rules and you take it, and then you kind of realize that the rules don't really make sense, that you're not allowed to take them. So how was that first experience for you like?
Yeah, so my first couple were actually using currently legal psychedelics, which Terence McKenna would talk about how if something's legal, it's probably because it's not very good. So the first one was a Salvia divinorum. Yeah, so I did a tincture of it and had a guide that led me and a couple close friends. I was actually getting over the flu at the time and had a fever. So it wasn't necessarily an ideal state to have it in. But that one, it didn't really offer a whole lot. I think part of it was I was still learning kind of how to trip in a really productive way, and how to kind of explore those realms. But I did have a bizarre experience during it. So getting over this flu, so you hold the tincture in your mouth kind of till it takes effect, right? And when I went to spit it out, like there was there's this mucus that kind of was like I spit out and it was still just like coming out of my mouth, and like it wouldn't. Usually if you spit, like it's boom, it's there and you're done, right? And so it's this, like, to me it looks this kind of shimmering, translucent, like mucusy snake. And I'm thinking I'm probably hallucinating or something. I'm still kind of learning how this stuff all works. And I kind of, as it's hanging from my mouth, I look around at two close friends, and I'm kind of thinking, like, are they seeing what I'm seeing? And I don't know what to do. So I just start grabbing it with both hands and pulling, and it just keeps coming. It like breaks off, but it was bizarre. And then I asked him after the trip, I was like, I need to know if that actually happened. And they confirmed it. And for them, they saw it also as this like shimmering thing, which to me, this is kind of an interesting area with these experiences, right? Because like, whatever in that state, we all saw it as a shimmering thing. I don't remember what the guide was saying because he was sober, right? But it becomes interesting to explore, you know, like shared experiences and what kind of bizarre things like that, like what's actually happening. But so that was my first one. It was interesting, but I didn't really get a whole lot out of it. And then from there, I tried morning glory seeds, which contain LSA. It's the kind of cousin of LSD, you could say. It's pretty like physically difficult to do that. You usually need at least like 300 seeds, and you chew them until it's like mush and swallow it. It's a lot to stomach. But I did that 5 different times, and was able to. So I'll kind of go into a little bit. I have a long history of severe migraines, and to me, like that was kind of my early altered states was these just horrific migraines growing up from the time I was about 6. And so to me, kind of moving into using some of these altered states, it stirs a lot of that up. So with these morning glory experiences, it really gave me access into processing the physical trauma of the migraines. Without going into too much kind of detail, but some of them, what I would find is there's certain kind of I could feel in my nervous system how it stored the trauma of the experiences and how that had kind of changed how I move and function. And so I'd have these sort of you call them like abreactive experiences, right? It's kind of this like physiological release that would happen on morning glory seeds, and it kind of I did it alone. If someone were watching me, I think I would have looked like I was having some sort of like epileptic seizure. Not like a very violent one, but the movements were really kind of jerky and bizarre looking. But internally, I could feel how they were related to the physical trauma, and I could kind of just let the process unfold and feel how it was like it was working out something that was stored pretty deep in me.
To hop back to the salvia experience, I've only picked up one of Terence McKenna's books, and it was True Hallucinations. Again, it was an audiobook, and he also talks about like a translucent kind of liquidy stuff in that. I don't know if you're familiar with that work, or
I hadn't heard of that. I've heard him talk about his salvia experiences. His first one is, if you look it up on YouTube, it's hilarious. He describes when he closed his eyes, it was like there's these like birds, and it looks like this kind of cartoon world, and it went on like that for like, how was it, like 15 or 20 minutes. And I can't remember what they were saying. They're saying something like really like what you'd hear in the kids, like I don't know, it's something like you're here to have fun, or like it's okay, or something like that. And they just kept saying the same thing. And his kind of like conclusions, like, what is this? Is this like the Sesame Street of psychedelics? Version? But yeah, I don't know too much with that. But it's an intensive state, and what he describes is when you close your eyes, it's like you're instantly in a different reality, which I experienced, but I didn't yet kind of fully understand how to explore it. One of the big things with psychedelics is when you go higher dosages, having closed eye experience takes it a lot deeper. And I remember like I would close my eyes, and what I connected it to was Pink Floyd's movie The Wall. The animation in that was like internally that's what was going on. So I'd close my eyes and it felt like I was like in this kind of Pink Floyd trip.
Do you have any like things to keep in mind too? Because you mentioned it earlier, and I found that really remarkable, is to trip productively. What are like the things that you have to look out for to trip productively, basically?
Yeah. So the first thing I would say is, especially as you're increasing dose with a substance, to me, the safety of the environment becomes more and more important. And safety expands beyond like your physical safety. I would say any day-to-day concerns, someone texting you, a friend coming over, say having someone that's with you that doesn't really have a clear understanding of kind of the stuff that might come up. And so they might see what you're doing as kind of bizarre or scary. All those things are like going to really take away from where you can go. So I'd say like the more that the setting is one where anyone there is like someone you can completely trust. And the substance you're taking, that you're completely confident that it's pure, it's what you think you're taking, you know the dosage. um, all that stuff's very important. And then even detail things like if you have a playlist or something you're going to play, you don't want to be fumbling around with that, like when you're in that intense altered state. All that stuff's going to become difficult and disruptive. So that's kind of that end of it. Another thing I find is like having intention going into it. What are you going for, right? And so what I see a lot in more recreational use is people get kind of caught up in the fireworks of it. There's cool, trippy stuff that looks crazy and doesn't seem like it could exist in reality. And that's all great, but like, there's this whole idea in Buddhism of like the bodhisattva, right? Which is this kind of the Buddha that like brings something back, that returns and like has something to offer from their experience. And I kind of keep that like as a category for like what to do when you're tripping. If you go there and you just kind of see some cool fireworks and come back and that's the extent of it, like great, but don't expect it to really change your life very much. And don't really expect others to have like a high degree of respect for that approach. I think we can have like a very open, non-judgmental approach, right? Where people that want to do that, like, great, let's have space where they can do it and have fun, right? But it's different. So, and I think a third thing for me is like, I think of it like, what are your personal ethics for tripping? And so two of them that I really value, one of it that I always go in with is the kind of fearful part of myself. I kind of go through this like visualization where I'm like, okay, you're going to sit in the passenger seat for this trip. Like the one that's going to drive it is the one who's courageous, who can ask the hard questions, can confront reality, whether it's painful or whatever comes up. That's the one who's going to be like driving this thing. The other thing is this kind of, I think it's important to keep as open and curious a state as possible. So to me, like keeping a skepticism to me is unhelpful, because skepticism, similar to like fundamentalism, you're sort of you're taking a position before encountering whatever it is you're going to encounter. So if you're kind of dismissing your experience as it's coming, you're not going to get very far. So that's where kind of the openness and curiosity is helpful. But the other end of that is like not believing what you want to be true. And that's where people can go off the deep end, right? Is that you have insights, you experience realities, and if you don't have the mental discipline to kind of check yourself and say, what do I actually understand to be going on here? And instead just kind of run with it, right? Then you come back and you say, you know, I've tapped into the greater secrets of the universe, and this is my divine role, and I'm going to heal, you know, this entire planet. And it's not that is all untrue, but it's not grounded, right? It's kind of this delusional realm. And so that ability to kind of steady your own mind, and keep that calm presence in the face of intense realizations into the deeper layers of reality, is something that I see as kind of a discipline, almost like a spiritual discipline of tripping.
Yeah, I mean, it kind of sounds like what Terence McKenna does the whole time, right? He kind of observes what's happening, and then, I mean, he holds these talks for like an hour and a half long, and he just describes what's happening. And I mean, it's just mind-boggling as well.
Yeah.
So we mentioned Stan Grof earlier, who's like one of the founders and like main theoreticians of transpersonal psychology. Now, for someone listening that has no idea what that is, how would you kind of describe that to them? Like, give a general idea of what this transpersonal psychology is.
Yeah. And give me 1 second. I'm just going to plug my laptop in real quick.
Sure, all good.
All right. So, okay, so what was that again you were saying?
Like an initiatory. I'm not sure if that's the right word. If someone's never heard of transpersonal psychology, how would you describe it to them? How would you introduce it to them?
Yeah. So I would say, like, look, it opens up to kind of these like extreme or the outer edges of human consciousness and experience. It has much more of an openness to those and exploring them than traditional therapies do. So to get into more specifics of that, something like Stan and Christina Grof came up with is this idea of spiritual emergencies. So things like psychotic breaks, anxiety attacks, midlife crises, right? All these kind of things that we think of as like acute mental illness. From a transpersonal framework, those are considered through the lens of, is this sort of a potential opening into a higher state of consciousness? So, to give a personal example, that I talked about, like the morning glory seed experiences, right? Leading up to those, my own fear of death was at an all-time high. I was struggling to kind of function in life. I was noticing myself so preoccupied with thoughts about death that I was missing things I usually would be attentive to in my life. And so I could look at that, right, as this kind of like crisis, but it initiated that level of stress. Was on one level was a way of me realizing I could not continue to live within the framework I was in, and I needed to have significant movement. And so that emergency becomes an emergence, where you kind of emerge out of it as something new with a greater perspective. So like what Stan Grof gets into a lot is this idea of the birth process, and that we can look at a lot of our life as a repetition of the birth process at higher levels. Which then, when you look at that, we can have these stages where right before birth, right, you're having the uterine contractions, which are not going to feel comfortable on the fetus, right? And so then from there, it's essentially getting forced out into an opening that sure doesn't look big enough to fit a head. And so that's going to come with potentially strangulation, suffocation. It's a very unpleasant experience, but at the end of it, the child emerges and is open to this spacious light experience. and then that's immediately followed by a connection with the mother, right? So that kind of pattern of being in a sort of stable, comfortable state, that comfortable state starting to kind of close in and feel like it's no longer tenable, and then sort of a push into what feels like there's no escape, eventually to emerge. That's kind of a pattern that, like, transpersonal framework, I'd say we tend to be attentive to.
And so I was listening to a talk, I think by Stan Groff, and who described transpersonal psychology really in a cool and beautiful way, I found. And he said that it was the science of the soul, which I found I kind of had to pause the video and then just think on that, because like, I'm only, I think, 160 pages into the book, and I just actually got to the part where he discusses BPM 1 through 4.
Yeah.
I cannot come on what the BPM stands for, but it's the stages of the birth, which you just described.
Yeah, the birth perinatal matrices.
Yes, that's exactly what it was. And what really, really fascinated me in the book is, I mean, I've not me personally, but throughout my life, I've been very close to mental health issues, if you can call them that. And what struck me is that in the book, repeatedly it stated that these states like psychoses or schizophrenia are exactly what you said, are these just temporal things, and if you guide them right, then they can actually really benefit the person. And I also saw on your website that you offer help to people going through schizophrenia or that are struggling with that. And I was just wondering how you would approach I mean, of course they approach you, but how you would approach someone coming to you that is dealing with schizophrenia or is having a psychosis, for example.
Yeah. So in kind of the more extreme levels, like, because I work in like an outpatient setting, so the more extreme levels, like, they need more support than I can offer, but in the range that I can work with, so typically how it's dealt with is through antipsychotic medication, which if you look at some of the different critics of that approach to treating it, and a lot of times people's experience, it makes them look more socially acceptable, but it doesn't improve that person's life very much. I can't say that across the board, but I've seen that numerous times, and there's some pretty good critiques of how we approach it. But if instead of trying to make these people going through psychotic episodes presentable, and instead we look more to what would healing in actual, like, genuine care for them look like, it's so I look at it as, like, we all have these different processes which we need to work through and complete. And to the extent that we can do that, we can kind of freely move through our lives. This kind of comes from like Gestalt psychology, gets into a lot of this idea of, like, more process oriented. Or another psychologist is Arnold Mindell. He has one book called Working with the Dreaming Body, which gets into his approach pretty well. But so a way of looking at someone, say, having a psychotic episode where they're hearing voices, maybe they're having visual hallucinations, right? Is that it's an externalized version of processes that people would usually have in a more internal way. So I would say with many of my clients, I work with this idea of like that we have internal parts, right? So that we're not a single entity. So we might, we'll use language like, your child self, or maybe your like I did earlier with like my fearful self, right? So that fearful self, like to me, that feels like a different state of consciousness. And when I'm in it, I can feel that. I can also feel this sort of like this sort of emotionally disturbed self, right? That gets kind of dysregulated, and maybe I get upset or angry, right? That state feels very different than kind of maybe like a wiser, calm self that can take a broader perspective, analyze situations. So when we use a model like that to understand ourselves, we can start to feel when we're drifting into these different parts, and start to kind of pay attention. What are their needs? What are they trying to get? What needs are trying to get met? What things do they struggle to do? Right. So like for me, that scared self, anything that takes courage, it struggles to do. Right. It's kind of putting the brakes on. But putting the brakes on also has value. Because like growing up, I wasn't the kid who would like go cliff jumping and not look for rocks. And so that's a survival mechanism. But if that's the only self that's operating, like I become a fearful person who avoids a lot of valuable experiences. So that's kind of your like run of the mill every day, what I think most of us experience. Someone dealing more with schizophrenia and psychosis, that gets kind of projected out on their environment. And so for me, it's like rather than try to shut those voices up, or distract ourselves away from whatever visionary experiences we're having, it's valuable to instead explore them, right? See what are their needs, what are they trying to communicate, and then in all that, similar to like tripping, working on keeping that kind of steady, calm frame of mind, and maybe developing. Common with schizophrenics is they can go pretty far off into delusional thinking, right? So they're pretty much making these series of connections that leads them to thinking, aliens have overtaken Congress, and it's their special mission to inform the president so that the world doesn't come to an end, right? Like that's far out there thinking. But how they got there would be through a series of assumptions that in a steadier frame of mind they could have saw and questioned, and maybe had people in their life that could help give feedback on that. So like if we're looking at more severe cases, there was I don't know if you're familiar with Esalen Institute. It's in California.
I've heard it pass by a couple of times. Yeah, I'm not really familiar what it is, but I've heard of it a few times. Yeah.
There's a great book on it called Esalen: The Religion of No Religion.
It's a great title.
Yeah, it goes through the history of it. But one of the co-founders there, so it's pretty much a place where a lot of alternative therapies. Terrence McKenna did a lot of his talks there. Stan Groff had a residency there. Let's see, figures like John Lilly, who did a lot of stuff with ketamine. So a lot of figures like that would give talks there and do residencies. But one of the co-founders was Dick Price, and his framework was more Gestalt therapy. And so he would actually work with schizophrenics. They would come to his, he had a space for them where pretty much him and a few other people would support them in going through their process. So kind of it was a space where they could look as crazy as they needed to look, and no one would judge them, and whatever they needed, however they needed to move, whatever they needed to say, you know, whether they were screaming and yelling or interacting with entities that no one else could see, it was all accepted, and they were encouraged to continue to work through it. That requires a level of support that, in my opinion, like our society, most societies right now can't stomach. I think it's not just like offering that support, and this I think is true with psychedelic therapy too. Sometimes the processes we need to work through look bizarre. So they get into things like different taboos that we have, whether sexual, whether aggression oriented, all these kind of areas that, like, you know, I think as a society we like to think that we are accepting, but similar to like seeing blood and guts, people turn away when people are going through those kind of processes. So that's kind of what I think would be most helpful for offering kind of the optimal care for people going through these things, would be that we actually have professionals who can stomach those kind of experiences and remain compassionate through them.
And so have you had personal experience seeing people recover from these severe mental struggles, and like how, and if so, like how do people emerge from going through that process of well, you know, going through it basically?
Yeah. And like I was mentioning, I haven't worked in, say, like a inpatient clinic where I'm interacting with a lot of the very severe cases. So a lot of that's through more like reading case studies and that kind of stuff. But personally, I've dealt with some like higher functioning clients that have dealt with schizophrenia, and
what exactly does that mean, a higher functioning?
Higher functioning, so that pretty much their day-to-day life is fairly manageable. They're, you know, someone who's not at high risk for, say, being out on the streets, you know, where maybe they're not highly suicidal.
Okay.
They're not a huge risk to other people. So in those cases, like, I found operating within their framework, getting their experience of what they're going through, and then kind of working within it. So, you know, like I had one client where a lot of that was he integrated his experiences through artwork. So he was Native American, and through that, the traditional artwork that they would do, he was able to really kind of create different symbols, you know, different things that would, it became kind of a container or a structure for him to process what he was going through. And that's kind of more in line with, like, in indigenous cultures, there's often this idea of something like what we would consider a psychotic break could be an initiation into, like, being a shaman. And so a community like that would actually look to support that person and try to kind of see how can they integrate it to actually benefit their culture. So I kind of like, that's a helpful framework. And I work with a kid who dealt with it too, which you often don't diagnose it with kids very young, but it was clear, like, that's what he was dealing with. And that was pretty fascinating. This kid saw aliens. This experience with aliens where they showed up one night, like he woke up to them being there. They were kind of the grays. Like I didn't tell him, like, oh, or did they look like this, right? I would just ask, what did they look like? And so he had described them as what we would typically called like grays. So if you kind of just like search online for like what different people describe that say they've had these encounters, like they usually have the smaller versions, which are like a lot shorter than people, and then ones that look about like 6 feet, 6'1", like around that height. And so his were the taller ones. And there was this portal, this kind of vortex portal that he described looking at, and eventually he passed out, like looking at it. And so this kid also had experiences where it looked to him as if other people were possessed by like the aliens could inhabit bodies for a while, and there were certain signs that they were doing that. He would see these kind of ghost-like geometrical entities in his room. He would have these kind of in the hypnopompic state, which is the state between dreaming and waking. He would often have kind of the beings from his dreams would carry over. So when he would wake up, they would be there. And so there was these kind of sometimes struggles there. So, you know, it's like, okay, kid dealing with that stuff, right? How helpful is it to be like, okay, what you're experiencing isn't real. You know, you need to stop imagining, or, you know, kind of work through like when that happens, whether they're medicated or whatever, right? In his framework, this is his experience of life. And in his case, it was really bizarre. I still don't quite know what to do with it, but he had a number on his face and freckles. So there was a 2-digit number on his cheek. And his mom said this showed up after he said he had this alien encounter, like within a week of that. And at first, like, she brings this up and I'm thinking like, what is she talking about, right? And then she's like, well, show him. And this kid gets close. And, you know, there's a part of us that like can look at clouds and like see things, right?
Yeah.
It wasn't like that at all. They didn't tell me the number, and I looked at it and I'm like, holy shit. It was as clear as if someone had drawn with freckles, you know, this 2-digit number.
What?
Yeah, and so I didn't know what to do with it, but that's kind of like with these things, I try to keep that approach of like keeping an open mind, but not jumping to conclusions, because I don't know. Like, I don't know if there's interdimensional beings that can make contact with us. But I also can't claim that to be real, because I mean, I definitely don't have enough knowledge to, you know, live my life as if that's a fact.
Yeah, and even if that's so, how do you even prove that, right?
Right. Yeah. So to me, it's a lot less about like proving it as to maintaining this kind of open state and seeing where it goes. And if that goes to, this is some kind of internal process to be worked out, great, we'll do that, right? If it's, they are interacting with some entity, and even if we never know, someone can still, they can still have their own agency in whatever they're going through. And so to me, it's like, if you experience a world in at least part of the time in a psychotic way, developing kind of your own bearings within that is a value.
Do you know like a particular case maybe that someone went through this these episodes and then kind of became well, you mentioned that people in tribes, they don't push these people away that are going through these episodes. They kind of embrace them and make sure that their environment is well positive for them going through that. And is there any like modern day equivalent to that? Are there people that have gone through these states and then emerged like as a shaman, basically?
Yeah, I read one fairly recently. I can't remember the reference, but it was an article going through a guy, I think he was in his early 20s, that was diagnosed schizophrenic and had gone through a lot of the traditional treatments. And eventually him and his dad really kind of took his care into their own hands and started looking for like ways that they thought were actually going to work. And they got onto more of the kind of pathway I'm talking about. And he, I believe it was, he really got into more like indigenous forms of drumming. And that became something he could, he started to join a certain community where that was a really, integral part of it. And would have that kind of be one of his practices. Yeah.
And then he was able to manage it better, or like did voices?
Yeah, it's kind of like one way of looking at it is that we all have a need for meaning and purpose in life. And if you are dealing with something like schizophrenia, and your society's container for that, like its frame of reference, is that this is the most bizarre, crazy state of consciousness someone could be in, and we need to lock them up and give them medications that are so strong that they look pretty catatonic and expressionless. Like, if that's your model, how do you integrate into a society like that, right? There's no, so you've set up the conditions for those people to fail. And so it's like, yes, dealing with those conditions is the more extreme as far as like how difficult it is. It's like, I don't think that people dealing with that are easy success stories, but it doesn't change that, like, if they are going to make it in life, they have to have some route to having some sense of meaning and significance. And so when you have, whether it's through art, whether it's through some forms of spiritual practice, whatever it is, if they can get on a route like that and start to make sense of their world from it, they're going to be better off than they are with the alternative.
Would you have any like advice if someone's listening to this and they're dealing with either depression or anxiety, or what we've just discussed, they think they might be going through like a psychosis or schizophrenia? What would you advise them to do, and just something to keep in mind for them?
Yeah. I think so. I work with anxiety a lot. So maybe I'll jump in there. One of the things I do a lot of with clients with anxiety is focus on it as an actual strength. So how anxiety typically gets framed as if it's sort of a it's an illness, right? So it's a thing that we have that's wrong with us. So if that's our premise, then we want it to go away. And so we take anti-anxiety medication, we go see a therapist and say, give me tools so that this doesn't happen. I don't think that's really correct. Anxiety is like a heightened state of alertness to keep us safe. So when we look more, when we look more for survival, that's safe from potential like life-threatening predators, right? It's from anything that might threaten our life. But in modern society, that's things like being ostracized from your family, being not perceived well in your work environment, right? Which can come at significant personal cost. And kind of the list goes on of being in our friend group, maybe being, seen as not kind of really in on it, right? They were kind of a little bit outside of that group. All those are forms of threats. Um, and so what I see with people dealing with anxiety is they're extra tuned up and sensitive to what doesn't feel safe or comfortable in their life. And so when someone says something, say with a harsh tone of voice, right? Someone who's not very anxious, they might kind of shrug it off and be like, "Ah, what an asshole." But to a person who experiences high anxiety, they feel the break in that relationship, right? Because that person's not just an asshole. That person has disconnected from them as another human being. And so if you take that as a starting point, and see that as actually a strength, right? You have an enhanced perception of a certain type of human experience. You can build off that. So now when someone's an asshole, you realize that person's not tuned into other people in a way where they can effectively deal with them. Right? So say you're a manager at a business, right? Now you can start being more and more attentive to that. And when instead of, oh, I'm experiencing anxiety, it becomes this person's out of touch with the office environment and how they're treating other people. And so then you shift instead to helping them tune in. For let's just say like for a woman that may tune into what feels like anxiety on a date, right? She might be picking up on this is a threatening and dangerous man who's not who's showing clear signs that he's not very safe to be around. And so that could lead to ending that interaction early and preventing a harmful person from causing more harm. And those kind of scenarios come up all the time in our life. So if we just stop at I have anxiety, we miss like this wealth of opportunity that when we're able to really develop that skill, which I've been able to see with numerous clients. It's awesome to see like what once looked like this kind of neurotic anxiety that was troubling their life become something that they can be like, no, like this is actually something that enhances it.
That's really powerful. I never thought of it that you could approach anxiety simply by flipping it and turning it into a strength, basically.
Yeah.
I think we'll not really wrap up right about now, but start wrapping up. Is there any final like advice that you could give to people? Is it a favorite? It can be a quote. It can be, for example, just a recommendation of listen to Carl Jung or Freud. What would you give as a last piece of advice?
Yeah. Let's see here. Yeah, as far as listening, a couple of my personal favorites for those that you know like a lot of talks and stuff, less of the reading. Terrence McKenna's awesome. He's fun to just kind of go through YouTube and you know pick what seems interesting and listen. Another favorite for more of that style is Alan Watts. His books are great. He has like the book, what is it? The book on the taboo against knowing who you really are. But yeah, he has a ton of talks on YouTube, which he's able to really condense a lot of deep spiritual truths and things that are very relevant to things like psychedelic exploration into these talks. Let's see here. Another, so we didn't get into it much, but I have a lot of background in religion and studying comparative religions, and I grew up within the Christian tradition, and I find like there's a lot of, when you kind of get on the right path with that, there's a lot of good stuff. So one of my favorites there was Huxley wrote a book called The Perennial Philosophy, and he pretty much took years of studying most of the major religions, and taking a lot of what their mystics have said, and putting it in, kind of categorized it, and then wrote his own commentary. But it gets kind of at the core of, I think, what religious traditions have to offer, on the more positive end. We see like a lot of kind of where they can go wrong, I think, in everyday society. But yeah, that's for me kind of an interest beyond kind of what we've gone into as far as with psychedelic therapy. An interest I have is how we can look to integrate these medicines into religious traditions, because I think what I see, particularly with Christianity, is that it's starving for authentic experiences like that can actually inform how people in those communities live, rather than going off dogma, presuppositions, kind of like tribalistic thinking, which from what I see is like a huge area where they're kind of doing harm right now.
All right, awesome, man. I can't thank you enough for your time. It's been almost 2 hours. Thank you for being so generous with your time.
Yeah.
Is there anything that we missed and that you might still want to discuss?
I think I covered most of it. Yeah, let's see. I've got my website, sailorseacounseling.com. It's pretty basic right now. I'll probably develop it over time, but I give kind of an overview of ketamine therapy and some other stuff there. So that's kind of, especially if anyone's ever looking to connect to do ketamine therapy that's up in the Northwest, like that's probably a good way to reach me and go forward with that. Yeah, I think that covers most of it, though.
Awesome. I'll be sure to link your website and your profile on the MAPS website as well. Maybe your socials, if you'll give them to me in the descriptions of wherever this is going to be posted. So that if people want to get in touch, then I'll make it very easy for them to do so.
Yeah, sounds great.
Okay. I guess that's going to be it, man. Thank you so much. Again, I hope in the future we get to talk again to explore this subject even further. And yeah, thanks once again.